Hi, here at MySocialSecurityLawyer.com and pound SSDI, we are trying to provide you with the information you need to protect your rights. One of the questions we get asked frequently is, how do I prove that I am totally disabled under the Social Security law? These are medical cases that turn on medical proof. The focus is entirely upon the clinical charts of the treating medical specialists. We explain to every new client that their testimony as to their symptoms and limitations is not proof that they cannot work. They're seeking the benefit, so their testimony is always questioned by Social Security. The testimony of a spouse, child, relative, or neighbor will also not be determinative since they apparently like and care for the claimant. Social Security cases start with the doctor's charts. Social Security expects that people who are suffering with symptoms so bad that they must meet the definition of total disability will be going to the appropriate medical specialist and describing those symptoms and problems. The more consistently someone goes to their specialists and describes their symptoms and limitations over months and sometimes years of medical treatment, the greater the chance of having the application approved. When we meet with new clients, we spend much of that first meeting trying to identify who are the doctors that the client is treating with and whether they are the appropriate doctors. Social Security wants specialists. If the problem is back pain, then they want claimants treating with an orthopedic or a neurologist or a pain management physician. If a claimant has a mental illness such as depression, anxiety, PTSD, or bipolar, then they expect both a psychiatrist and a therapist or a really good PhD or PsyD psychologist. Fibromyalgia clients should be seeing a good rheumatologist. The notes of these specialists will be reviewed by Social Security doctors, adjudicators, and judges. They'll look for evidence of the symptoms and for consistency in the complaints of the patients and the findings of the doctors during the examinations. Medical reports from the treating physicians are useful and are usually solicited during the course of the case. However, proof are the clinical charts of the treating medical specialists. To learn whether you are developing the evidence that you're going to need to prove that you are totally disabled, you can contact an experienced Social Security disability lawyer through MySocialSecurityLawyer.com or by calling pound SSDI on your mobile phone. This will help you get the benefits you deserve.